Thank you for the opportunity to be here. CoapTech is developing the Puma system. We're a medical device company out of Baltimore, Maryland, and the Puma system is a new category of minimally invasive surgical devices. Puma G, our first device, is 510(k) cleared and is proving to be the best way in the entire world to put in a feeding tube for adults and for children. This technology, Puma G, has been used in over 1,000 patients, and our safety data is proving to be an order of magnitude safer than the current standard of care. And our value proposition, our business case to hospitals, is a grand slam. We're in 35 hospitals today. We did over $1 million in revenue last year with a small sales team, and we're ramping. So we're raising money to scale this business. We're targeting $9 million in new funding. The Puma system fundamentally is a portfolio of really simple catheters. These are mechanical devices, and we're riding a big wave in medicine. Ultrasound, most people don't know this, but ultrasound has become the #1 most used imaging mode in the entire world. It's a lot like cell phones. Everybody's got a cell phone. Everyone in medicine has ultrasound, but it doesn't work anywhere there's air in the body. So really important regions like the lungs and the stomach and the bladder and pubic region have been out of bounds for ultrasound. A doctor at Hopkins figured out how to use ultrasound using these simple catheters in these hollow regions. So we're taking the #1 most used imaging mode in all of medicine and bringing an entirely new set of organs and procedures online for this modality. It's a big deal. The first thing we're tackling is feeding tube placement. These are sick patients. They're typically in the ICU and they've had a stroke or cancer or a major surgery or trauma. These patients in today's world have to wait days and days for a GI surgeon or a specialist to be available, and it's a very unsafe procedure. We've got a safety and a business case that I'll show over the next couple slides. This procedure is really important in medicine. I met 3 people here tonight who told me their family members had had feeding tubes, and it's expected to swell in the next 10 years as the silver tsunami hits the US medical system. So because this technology lets the procedure be done with ultrasound, and it's the only way in the entire world to use ultrasound to put in a feeding tube, it can be done at the bedside. What does that mean? Instead of the ICU doc needing to call a specialist, they can just grab our kit off the shelf, the ultrasound probe they already have, and they can do this procedure themselves right at the point of care. So you don't need to wait days and days for a surgery and chew up the hospital's margin, profit margin on the admission. The team can just take care of the patient when the procedure is needed and keep them moving on their continuum of care. We've got peer-reviewed literature showing that this device saves hospitals about $25,000 each time it's used. So that allows us to charge a really nice premium for this product. And you can see revenues are growing really nicely. We did over $1 million in sales last year. We're at about $1.3 million in trailing annual revenues. And this was with just 2 salespeople. So we're raising money to scale what we believe has been validated in the market. We're working with a lot of great clinical partners. We thank them, some here in Virginia, some in Maryland, and many all over the country. And we also have a pediatric version that's currently in clinical trials at CHOP, funded by the NIH. We can put feeding tubes in children using no radiation at all. Radiation gives kids cancer at vastly elevated rates. Doctors will go to great lengths to avoid it. We think this is going to become the new standard of care for feeding tube placement in kids very quickly, and the doctors using the device are calling it a game changer. So we're on the radar screen for a lot of strategics. We've had 2 M&A offers for the company already. The math wasn't quite right and the board declined them, but we're being tracked by all the big players in this environment, building very strong relationships with them. And the most likely exit will be an M&A to one of those players for this technology. To summarize the deal quickly, we're raising up to $9 million. We have a lead investor committed into the round. And this investment is in Maryland, and there's a great biotech tax credit program in the state of Maryland where investors can get 33 to 50% of their investment back in the form of a check from the Treasury. So it's a cash back investment, not a write-off. And I'd love to follow up with anyone after this. We have a booth outside. You can check out the procedure and see the technology. Appreciate the time. Thank you all very much.